and welcome to this episode of the Good Citizen podcast. One of the reasons I launched the Good Citizen project and jumped into my work with the Church Ambassador Network here in Indiana was a simple but troubling observation, and here it is. How can we have so many churches in our cities? It's especially true if you're in the Bible Belt, but really around the country to some degree as well. How can we have so many churches and such little measurable impact in our cities? As a pastor's kid, as someone that's been around the United States ministering, this this has really troubled me, and it especially struck home one time when I was in a leadership group in my home county, and we were discussing community needs, and someone raised their hand, and this was not in a hostile environment, but someone raised their hand and asked, so what role do the churches play in some of these common questions like homelessness or addiction recovery, etc. And the presenter, again, I didn't sense that the presenter was hostile towards people of faith, but just said, well, the churches aren't really much of a player in these areas, and that's really went right to the heart. And ever since, we've been moving to try to address that. How can we help the church serve its way back to the center of our cities? And so today I wanted to dive into something that we recently released called our Community Impact Plan. And this is specifically focused on the state of Indiana. But when we were going through this, we did so with the idea that the same principles that we have applied kind of in our own zip code, in our own state, could really work across the country, because we are seeing similar dynamics around the country. Wherever there is an internet connection, you're seeing a lot of the same dynamics, a lot of the same problems. And so we have done the hard work of trying to apply this in a particular zip code with the idea of giving pastors, giving ministry leaders kind of a bit of a template that they could go apply in their community, really wherever they are in the United States and really around the world as well. Our plan is to eventually create just a community impact plan that applies to the whole country. But we just released this in the state of Indiana. We're sharing it with pastors, with legislators, and so I wanted to get this template to you so you can think about it in your own context. And so I've kind of mentioned that big idea of how can we have churches? How can we lead churches? How can we lead ministries that are having a significant impact in their own zip code, making a meaningful difference on these issues so that we can ultimately point people to Jesus? And so I'll go ahead and share, if you're watching the video, just so you can see a little bit of what this document looks like. And I'm going to start by just sharing a little bit of our methodology, and then some of the kind of baseline principles or values that we have in putting this together. So the genesis of this plan was a meeting with Governor Holcomb here in the state of Indiana back in the spring of 2022. And we simply asked the question, what are some of the worst problems in our state? How can the church, the Big C gospel preaching church, how can the church jump in and help with some of these? And Governor Holcomb responded almost just right away. Not that he didn't think about it, it's that he thinks about it every day. And he didn't have to take much time. And so he racked off foster care, the drug crisis, and mental health. And I kind of looked at him like, okay, yeah, we'll get on those by Tuesday. All right, we'll get to some these very complex interrelated issues. And so he mentioned foster care, the drug crisis, and mental health, and then encouraged us to go on a listening tour throughout state government. And so many different department leaders, executive branch officials in the state of Indiana have been willing to meet with us and talk to us about what they see as the problems in our state, and then some proactive solutions that, again, some of our best minds, our most creative thinkers in the state of Indiana are working on. And I am privileged to live in a state that is really thinking hard and trying to innovate, even in the way that government provides services and thinks through these things. And also a state in which officials do see the need for faith-based initiatives. A lot of times public officials just kind of look at me and say, we're trying to put a Band-Aid on a broken arm. We know we can't legislate purpose, we can't fund hope. That's something that comes from outside of just the basic government service. And so many times in these conversations, there's such a need. Sometimes people will scream separation of church and state with people when people of faith try to get involved. But I tell you, I have not felt much of that at all in this space. And so the doors are wide open. And what we then did is, after the the conversation with public officials. We then went to some of the high level, very effective, even long-standing ministries in our state that have great track records, very sophisticated. And most importantly, pointing people to Jesus. And we asked them, all right, how are you approaching these problems? And then what we try to do is pull all of that information together and make it as simple as possible, because we know for church leaders and ministry leaders, it really needs to be where, what, when, how, why. Like, show up at 10 o'clock on Tuesday with this many volunteers, and here's why. That's how specific it needs to be. And so what we did, and kind of the first page of this plan, is to provide a summary and kind of our leading recommendation for each of these areas: foster care, the drug crisis, mental health. The response from the church that we think is going to have the most significant impact, the response that's going to be very strategic, and we think, create a measurable difference in this space, so we can go back and talk to government officials about it. I did want to mention, again, just a bit of our strategy, but then also just some of our distinctives. And there's so many different efforts out there to make a difference in communities. We want to be very clear, especially when we're talking to church leaders and even government officials. What is our goal? Why are we doing this? Before we jump in to something, we need to have the end in mind. So one of our distinctives, of course, is that the state and the church are two God-ordained institutions, and they should be partners, not opponents. Now, that's complex in an increasingly secular/plural society, and as a First Amendment attorney, I understand some of the nuances there. But when you look in 1 Peter 2, Peter, again, a citizen, or not even a citizen, a subject of the Roman Empire, says that we are to submit ourselves to every ordinance of man, as under the king as supreme, and governors as under them that are tasked by God to, on one hand, punish evil, but also promote good. That second purpose of government. And then you look at the church's role: fulfill the Great Commission, do good works that point to Jesus. We think the state's promotion of good and the church's doing good are supposed to fit together like puzzle pieces. Again, complex at times, but we believe that's how God ordained it. And so that's what we're pursuing with as much energy and strategy as we can. A couple of the distinctives are that we want to partner with ministries. So sometimes a church, for example, my home church, Cornerstone, we may not be best equipped to provide residential care for an individual. And so we wanted to find ministries that we could partner with, but that those ministries had to have something very particular. Those ministries must be pointing people to Jesus. So it can't just be another United Way. And again, there are lots of great organizations out there doing lots of great things, but we believe from Matthew 5:16 that we're to do good works so that people glorify our Father which is in heaven. The idea is to make such a strategic difference that people ask, how did you do that? And we get to point to Christ. And so the ministries that we have partnered with, and that things that I'll recommend, and if you're looking in your zip code for a comparable ministry, again, you're looking for a ministry that, yes, they're making a big difference in physical needs, but their goal ultimately is to point people to Jesus. Something else that we also wanted to make sure was happening is we wanted to make sure that these ministries that we're partnering with were dedicated to working with and through the local church. So kind of two things we're looking for in partner ministries. They had to point people to Jesus, but also it can't just be you're providing people instruction about the Lord. We believe that the local church is the institution that Christ created, as messy as it can be at times, that the church is the institution that God created to transform the world. And so if there wasn't an element of, one, leading people to Christ, but then two, plugging them into a local body, we thought, this is not the best strategy, because we know that what people need ultimately is a relationship with Jesus Christ, and they need to be in fellowship and accountability with other believers. Another thing that we mentioned to church leaders as we've been talking about this, and even in the document itself, is we recommend that each church really focus in on its own zip code and on one or two key initiatives that the congregation is burdened by and equipped to address. I'm going to go through a lot of information here in a few minutes as I'm walking through these three areas. My hope is not to overwhelm you. There are certainly days I just sit back, looking at all of this information and my eyes kind of glaze over, like, wow, this is just so much. Our job is certainly not to boil the ocean. I think that the diversity of Christian calling is the answer to the complexity of the world's need, in the sense that God has tasked, or has tasked all of us with a specific task. He's equipped us, and he has given us life skills, life experiences, and he has given us a passion for particular things. And so let's lean into that particular calling from the Lord, just as the church is described as a body, and certain people are given different gifts. The idea here is not to ask every church to go try to launch 3 new initiatives. Actually, my hope is what we're proposing here isn't even really a new quote unquote program or new ministry. It's just something that helps your church kind of do what it is already focused on, but in a more strategic way. And so the encouragement, unless you're in a church that has a very large staff, a very large budget, and maybe you can do a few of these things, even all 3 of them really well. Even some of the larger churches that I'm talking to, they're really focusing in on maybe 1 or 2 of these, and then become known as the church that does foster care, or become known as the church that is focused on addiction recovery. And if you want to begin working on that, hey, go partner with that particular church. And so I don't want to overwhelm, especially if you're a church leader. It's not like you don't have 1,000 other things going on. And even if you're just a committed Christian, maybe you're not even in church leadership per se, even in your own individual capacity, I encourage you to think about, all right, maybe what is one thing that I can focus in on, rather than us just spreading our efforts out. We dilute our ability to actually make a huge difference. And so again, I wanted to go through a few distinctives. And in our strategy, as we're thinking through this, we see government as a partner. Sometimes that can be difficult and complex, but I believe that's how God created it. We wanted to find partner ministries that are pointing people to Jesus, working with and through the local church. And then we don't want to encourage the church and committed Christians to really focus in on maybe 1 or 2 things that they can do really well. With that said, let's dive into the big 3. And I'm going to start with foster care. And in each of these, I want to go through the biblical motivation, a little bit of the information that we learned about each of these, and I want to give you some proposed solutions. So again, I think, listen in as you're considering, maybe, God is calling me to do something new, and we definitely live in quickly changing times. How can we make a big difference in our community? Let's do that strategically. Here's some ideas for you. So with foster care, certainly the biblical principle we find in James 1:27 is pure religion and undefiled before God and the Father is this: to visit the fatherless and the widows in their affliction. And really throughout the Old Testament, you see there's always this grouping of 3 groups of people. You have widows, orphans, and the stranger, the foreigner, that were often, because of their social strata, were often left out or even oppressed by those around them. And so Scripture constantly, you can't read the Old Testament without constantly coming into that. I mean, even think about the book of Ruth. You think about so many different biblical passages of we are to care for those that are in a vulnerable position, and certainly those in foster care, children that have been orphaned. This is the same. So clear biblical principle. I don't often have to spend much time there. I think we all see the need to care for children in our society. Jesus himself said, "Suffer the little children to come unto me." As we have studied this, as we've met with the director of the Department of Child Services in Indiana, Director Stigdon, who's been on the podcast before, I so appreciate her heart of getting the church involved. She has mentioned that the greatest problem, therefore the greatest opportunity in impacting foster care, is actually prevention. And I remember just different times throughout my career practicing family law, understanding and hearing stats that the moment that a child is pulled out of their natural home, away from their biological parents, even if that's necessary, maybe there's abuse, drug abuse, etc., that the stats of being arrested, of not finishing high school, of unwed pregnancies, all of these impacts just go skyrocket. And so simple thought is, well, what can we do to prevent removal? How can we prevent kids from being pulled into foster care? And so Director Stigdon has asked the church to go upstream with DCS to keep kids out of foster care. And this is a unique moment right now for this area because of the Dobbs decision. If you remember, the Dobbs decision struck down Roe versus Wade and pushed the issue of abortion back to the states. A number of states have passed pro-life legislation, or there are a lot of states that are considering these things, even if they're coming back and it's a more progressive state and they're trying to pass restrictions that would to remove restrictions to allow abortion up to even birth. There's a conversation going on about how does our society serve vulnerable women and children. And so this is top of mind for so many government officials, so many in our communities right now. And so it's a wide open door for churches to get involved. In each of these areas, I'm going to give you kind of an initial step for church leaders. We have a distinctive, this is not original to me, but a distinctive that we move at the speed of relationships. And that's truly how work in discipleship works. Is certainly how politics works and things in government work. And so I want to give you a step that is driven by relationship to kind of jump into this area. And for the church leader, even for a committed Christian that wants to get involved, I would mention to you that you should go request a meeting, go meet with your local DCS director. That would be Department of Child Services here in the state of Indiana. In the state of Kentucky, it's called the Cabinet for Health and Family Services, Family and Health Services. And in other states, it's named different things, but essentially it's the Child Welfare Agency. Most of these agencies have an office in each county in the state, or they have a regional office. And so the idea here is don't guess how this problem is iterating in your zip code. Go talk to the person that's their job. They think about it every single day. And so I'm going to mention some things here that I would recommend is, go do this as number one, but it may be possible that in your zip code, it's iterating slightly differently. So again, that is my initial thought. If you are here in the state of Indiana, I have a link where you can look up all of the local DCS offices and find the one in your county. If you're in a different state, you can just go to that department's or cabinet's website, and you can search on that website and find the local offices. Call them up, and it may take a little bit of time because this is not something that's commonly done. But just tell them, hey, I'd like to come in, get to meet you, get to know you. My church wants to help, and we'd love to hear from you how to do so. And we found that the doors are just wide open for that sort of thing. Now, moving into our kind of primary recommendation in this space, and I'm going to speed up a bit. We will have a link to this document in the show notes. So if you want to go ahead and download that and take a look, I'm going to mention specific ministry names because we have done the hard work of going and finding the partner ministries here in the state of Indiana. You can do a similar task in your particular zip code and generally just asking around with church leaders, other Christians, hey, who's doing good work in this space? Maybe you meet them. But the primary recommendation, and a number of the church leaders we talked to said, I need like your leading thing. All right. I don't have a lot of time. So what do you think is the most important thing to do? And because of the request from Director Stignan to focus on prevention, but also just reflecting on churches and how church leadership works, we led with a recommendation that you partner with a ministry such as FamilyHope, which screens and trains Christian families to provide temporary hosting of children for families in crisis. Now, some of you may be familiar with a ministry called Safe Family. It is similar to that model, Safe Family. A number of Christians have kind of split from them due to concerns that they kind of went the way of Bethany Christian Services and aren't holding to an Orthodox traditional view of biblical sexuality and or practicing it in a faithful way. And so FamilyHope is one of these ministries. And what I love about this, again, it's kind of an initial thing that your church can do. And it literally is just the church being the church. You can imagine a single mom who doesn't have anyone that she trusts in her network. Well, the question was raised, what does she do if she has to go in for a surgery or if she has a second child? Now, if she's unconscious, DCS is literally going to have to step in. The state's going to step into that situation. Well, what if there's the equivalent of an Uncle Jim and an Aunt Sally that's been properly screened to make sure that it's safe, and they can just keep the kids for a little while? This is just, again, the church providing community people, and I just love the thought of being able to help people in vulnerable situations maybe just get back on their feet. And what's great about this is it keeps the family out of the system entirely. And you get to go to the state and say, hey, we saved you a bunch of money as well. So that was kind of our leading recommendation. The next recommendation was to participate in something called the Care Portal, if it is in your area. And if not, maybe to suggest to DCS or your cabinet or department in your state something similar. And Care Portal allows the church, when DCS or the State Department identifies a situation where there is simply physical needs, so no sexual abuse, no physical abuse, just simply there's not a bed, there's not clothes, there's no food in the refrigerator, that request can go out from the state agency to businesses and nonprofits in the community, and the church can literally show up at that door as the church to say, hey, we'd like to help meet that need. And as you can probably tell, much of what we thought through and tried to do with this community impact plan is to think about, we want to have a biblical foundation, biblical directives, but also we want to really focus on person-to-person interaction, being able to actually personally serve needs and build relationships. Another option is to partner with a ministry such as Isaiah 117 House. Isaiah 117 House began in Tennessee. It's in a number of states now. But on the worst day of a child's life, being pulled out of their home, a lot of times kids will actually spend the night they'll just either spend a day, spend a night in a local DCS office, which is basically just a boardroom or a bunch of cubicles. And sometimes they just have a trash bag with what they could pull out of their home. And so Isaiah 117 House came in and said, no, we're going to provide a home-like environment for kids on the day that they're pulled from their home. They have a great relationship with the state agencies that they work with. And then so you can kind of see how we've kind of gone down a spectrum of, here's how you can get initially involved and a little bit more deeply involved. And then certainly the last one here I would mention, or actually there's two more here, is adoption or foster care. Before I get to that one, though, you have a ministry such as Hands of Hope here in the state of Indiana. There would be similar organizations. If you know CAFO, Christian Alliance for Orphans, you may be able to look on their website and find something similar. And what Hands of Hope encourages, I love this idea, is to provide what they call a care community. And a lot of times, foster care parents will jump into the system, and they'll often, something like half of them quit after the first year, first placement. And so this care community allows the church to build a community around that foster family. Like, they're the one that has the child in their home. They're the one that, they're disrupting their schedule. They're taking on the needs of this family. So how can a church come around them? Maybe it's dinner one night. Maybe it's getting background screened and allowing foster mom, foster dad to go on a date. And that can be done not just for the families in the church, but also for the families in the community that aren't connected to your church. And then the last one that I would mention is just more traditional foster care and even adoption. I think a lot of Christians are already aware of this, but certainly there is a huge need. Indiana's about to launch a new effort called Every Child to try to use social media and other digital media to attract more families to jump into this. They want to closely partner with churches. So I'm excited about that. The new effort, we'll probably have an entire podcast episode on that development, as I think Indiana's may be able to do what the state of Oregon has already done and really lead the way on this. So every goal needs to be measurable. So we looked at the number of foster kids, the number of kids in foster care in Indiana, somewhere just south of 10,000 in our state. And we'd love to see that number drop significantly due to the church's effort. So that's how we're going to measure it. Again, I encourage you, there are similar ministries all around the country. And so you can take this plan and say, all right, perhaps where does my church, want to engage foster care? What's the most strategic way to do that? We've tried to go do all the homework. And so here you go. There's the issue of foster care. The second one, and I did mention to you that I'm going to be throwing a lot of information at you. Again, the hope is here, maybe there's an idea that kind of clicks. And if your church is not in the position to help some of these, you can kind of skim to the next section. But I wanted to go through these big three that our governor mentioned. In the area of addiction recovery, I think of Matthew 25, where Christ commanded his servants who commended his servants who fed the hungry, gave water to the thirsty, clothed the poor, healed the sick, cared for the stranger, and visited prisoners And he explained that performing these good works for the least of these is the same as serving him. So again, I don't think we have to go too far into the biblical motivation to assist people that have struggled with addiction, have spent time in prison, and are trying to come out and get back into society, get their life back in order. We had the opportunity to meet with Commissioner Regal, who is the head of the Department of Corrections here in the state of Indiana. And she mentioned, and this was true of others that are working in this space, she mentioned that the worst or greatest problem, therefore the greatest opportunity in this area, is recidivism. The tendency of individuals to fall into a cycle of addiction, broken relationships, and repeated arrests. In Indiana, our recidivism rate hangs at around 33%. So 1 in 3 that come out of prison are going back in. It's actually much higher around the country. There was also one other interesting stat that Commissioner Regal mentioned, that something like 80% of individuals in correctional facilities in Indiana have a mental health or substance abuse disorder. And so the state, its job, and I've actually shared this with public officials, that its job is to punish evil. It is to restrain evil, to maintain order. And in a society that doesn't really recognize the severity of sometimes actions, certainly as Christians, we would refer to these things often as sin. The state still has this job of, the gavel comes down. You have committed a crime and you must pay a price. That's a very uncomfortable place to be in our society, and the government's job is to do exactly that. So the first step in this particular area that I would encourage you to think about is to meet with a local judge or a sheriff to determine the problems and opportunities in your zip code. We have a U.S. or an Indiana Supreme Court justice that focuses in on addiction recovery, sentencing. This is one of the areas that he's focused on. And his recommendation was to join what Indiana is calling a Justice Reinvestment Advisory Council, JRAC. Government loves its acronyms as much as the church does, I think, maybe more. But the idea is that every county in the United States is struggling with how to respond to the drug crisis. There's the new influx of fentanyl, and you can't legislate purpose, you can't fund hope, and that's oftentimes part of this. It's a lack of purpose. You get stuck. A lot of people feel stuck in a small town and they don't know what to do with their lives, and so you're seeing this impact urban areas, rural areas the same. And so the idea here is go to the people that are wrestling with this every day and ask them, what are the problems? What are the holes? How can we get engaged? And a lot of places are putting together these councils where there's the judge, the sheriff, the local prosecutor, maybe the mayor or a representative, mental health professionals, and everybody's trying to figure out, probation office trying to figure out, how do we do this well? And many of them are actually trying to do outreach to the faith community to figure out, how can we partner with them? And they've mentioned to me sometimes they struggle with finding faith leaders that will get plugged in and help make a difference. So wide open opportunity there. Again, my recommendation is to start there. We move at the speed of relationships. Why try to reinvent the wheel or figure out a problem if you can go to the person that literally thinks about it every day? It certainly made sense to us. So the primary recommendation in the addiction recovery space was to find a ministry such as Wheeler Mission that assists with addiction recovery, and ask how your church can assist with discipleship and mentorship of the individuals in the program. Wheeler Mission, we've actually had on the podcast before. It's one of Indiana's and kind of the Midwest's leading examples of addiction recovery. They have recovery homes for men, women, just a host of services. And what they shared is the greatest need is mentorship, that one-on-one or small group mentoring of individuals that are coming out of addiction. Some of them have been on drugs since they were teenagers. They didn't develop some of the life skills that they need. And so you can look for your version of Wheeler Mission. Another ministry here in Indiana is called the New Day Center. They've done some amazing work that's been recognized at the federal level by helping churches develop a church culture that welcomes individuals wrestling with addiction and providing mentorship and accountability for them. And again, you can find links in the show notes to all of these ministries. Another thought is to consider starting or supporting a ministry such as Prison Fellowship. And in Indiana, we even have a state program called the Plus program that equips individuals imprisoned with faith-based resources and life skills. And what I really appreciate about Prison Fellowship is, first and foremost, they want to introduce those, they call them returning citizens. And I think it's a great phrase, with certainly an identity in Christ, lead them to Christ. But then they're also providing very basic stuff like, how do you budget? And how do you find a job? And so I think they're certainly the platinum standard there. There are other ministries too. We've just developed a relationship with Prison Fellowship. Again, they're all around the country. Another idea here was to consider starting a small group or weekly meeting at your church designed to provide community to families affected by the drug crisis. Most of our churches have a Sunday school model or a small group model, life group model. This plugs right into that. And there's an example called Brianna's Hope that you don't need to recreate the wheel. They've already done a great job of this. And what are the issues that's come up with individuals helping those with addiction recovery is that sometimes the actual individual that's been wrestling with the addiction, they'll help them overcome it. They help change their life. But we didn't realize quite how much it impacted the family. And so now the family, hasn't been kind of going on the journey with this person. Plus, you think about how kids are affected by an absent, say, if father is arrested for addiction, how that impacts them. And so what I love about Brandon's Hope and this idea is it is a whole family model. You're trying to minister to the whole family affected by addiction. In the state of Indiana, and this is happening around the country as well, the state of Indiana started what are called recovery cafes. In fact, they just placed one in my hometown in Madison, and our church, we're talking about how we could partner with them. And this is a place they recognize, people need community. You need to get them out of the peer group that led them to addiction. And so there are individuals, in fact, Amy Brinkley, who's been on the podcast, is now leading a Bible study. And people that may not be comfortable coming to church for whatever reason, she'll host a Bible study at the state's recovery cafe. So you can search for something similar in your space. Another thought is that individuals that come out of prison generally need housing, a job, and transportation to prevent recidivism. So consider supporting a ministry that provides that halfway house. Or there's a great business in Indiana called Purposeful Design that specifically employs individuals coming out of prison, gives them life skills, helps them get back on their feet. We've talked a little bit about that ministry before. So how do we measure this? We're looking at the recidivism rate. It's 33.82% in Indiana right now. And so how could we help significantly drop that number so that there are just a very small percentage of people in Indiana coming out of prison, going back in? That leads me to mental health, the third one. And this is a new and I believe developing opportunity for the church. Dr. Matthew Stanford, who was on the podcast, thought this was the mental health crisis is one of the greatest opportunities for the church in our times. And the more I've thought about it, the more I've studied it, I've come to agree with him on this. A couple of verses. God comforts us in our trouble so we may comfort others. That's in 2 Corinthians 1. And true rest and peace are found only in Jesus Christ. And so the church has an answer for the mental health crisis that, again, you can't fund through a grant. You can't legislate the purpose in people's lives. And so a couple of thoughts. Here in Indiana, there's a mental health roundtable. A lot of states around the country are starting these sorts of efforts. And so there are often already ongoing faith-based and state partnerships where individuals are trying to figure this out. Dr. Matthew Stanford also mentioned an interesting stat that even in an increasingly secular society, when people experience a mental health crisis, they turn first to the church. They still come to church leaders. And so how can we jump in and help with the mental health issue? I mentioned, I believe it's a really important opportunity for us now. So the proposed solution in trying to build a relationship would be to search for and connect with a Christian counselor or a mental health professional in your area to establish a relationship. In the next few weeks, we're going to have on a pastor and also someone that works in the mental health area that's going to talk about some of the mental wellness weekends that he does as an idea for churches that want to dive into this. But the idea is find the person that is kind of taking point in this. Indiana is starting what are called community mental health centers or certified community behavioral health clinics. And each state may call it something different, but there's a lot of federal funding coming into this. And so the efforts around the country don't look all that different. And you can generally search and find one in your zip code. And if you're in the state of Indiana, I've included a link, but you can look at the mental health department in your state and find similar efforts. And so again, we want to go to the people in the community already working on this and then ask them, how can our church help? So primary recommendation in this space is either to start or support a Christian counseling ministry in your area. We're blessed here in the state of Indiana to have one of the nation's leading biblical counseling ministries at Faith in Lafayette. Indiana Pastor Virus has been on the podcast, nationally respected ministry. And some churches will be led just to do the biblical counseling model. There also are Christians that are involved in an organization like Care to Change, which offers biblically informed counseling from licensed counselors. So I don't think that has to be either or. I think it can be both and. And so how is God leading you to jump into this? There are a number of ministries here in Indiana that are actually starting mental health ministries, counseling centers due to the need for this. Certainly wanted to mention the impact of this mental health crisis on the young, Gen Z, Gen Alpha. And so if you have strong student ministry, this is just a natural complement. You may be thinking about this stuff already. I did want to mention there's some free tools from Dr. Matthew Stanford that are designed to equip church leaders to identify mental disorders, develop safe and effective situational responses, and build a network to connect those in distress with professional care. And the idea here is many pastors are probably equipped, if you had a spectrum of 1 to 10, to deal with something like 1 through 7, 1 through 8, but aren't so prepared to deal with a disorder. And I think perhaps the best example of that would be suicidality. Most pastors would say, hey, we need to get some additional help here. But the problem is pastors will often make a referral to a mental health professional, and the mental health professional doesn't talk to the pastor. And so there needs to be this holistic approach to caring for people. So there's a link in the document to where you can go and just capture some of that free training if this is a new area to you. I also want to mention a network like the Full Strength Network, which provides low-cost support and counseling to pastors. Because how can pastors and other counselors, I actually asked this of the Christian counselors that we had on from Care to Change, like, well, how do you deal with this? I mean, you sit in a chair and people pour their worst problems on you all day. Like, how do you deal with that? And so Full Strength helps pastors to deal with the stress and pressures of ministry. Another idea would be to host a mental health weekend at your church and open sessions to the community. Again, we're going to have a podcast on here in the next few weeks to go through the nuts and bolts of that. Another great idea that I heard was going to the superintendent of your local school and asking how your church can help with the mental health crisis at school. Several churches, and especially youth pastors, I know have provided volunteer support for students in this way. The counselors at school are inundated, and the youth pastors were able to go in and assist. And then one other thought is to encourage members in your church to consider a career or ministry in the mental health field. Amy Brinkley, who was on earlier this year, mentioned there's a lot of focus on this. And I know this is not kind of a traditional ministry role, but this is a huge opportunity, a huge problem in our state. And here's an opportunity to actually do that as a vocation. So I think it's worth mentioning to the folks in our churches. So according to our particular state, only about 31% of mental health needs are being met in Indiana. And we need something like 300 additional mental health professionals and providers in our state. And so we're looking at those numbers as a way to measure what we can do. So I always just come back to Matthew chapter number 5 and verse 16. Let your light so shine before men. We see your good works and glorify your Father, which is in heaven. And you look throughout the New Testament, that idea of good works is everywhere. It is certainly it certainly complements the good news. Again, what people need most is a relationship with Jesus, but our good works can point to the power and the beauty of the gospel. We want to be doing that as strategically as possible in our states. And again, I don't want to have to ask that question. How can we have so many churches and such little impact? What if we literally could serve our way back to the center of the city, make a significant difference, even quickly changing times, even in an increasingly secular and plural age? And so I wanted to not just talk about it, but share with you that we've been doing some really hard work trying to figure out how to do this well. And so I wanted to share some of those with you. If you want to download the document, it'll be in the show notes of this particular episode. And then we'd love to hear from you. If there's an idea that your church is pursuing that is seeing some amazing results, I would love to hear from you. I'm always looking for new ideas. Just josh@goodcitizen.us, josh@goodcitizen.us, or you can put it in the comments of this particular episode. So thanks for joining us for this episode. Let's all get out there and do the hard work of making a difference in our communities.